Hello, this is Dr. Bailey. Today we are going to talk about fever and why it is so important. We will discuss some of the most common causes of fever, symptoms that your child may have during fever, and treatment for their fever as well. First, fever is nothing to be afraid of. It is simply your body's way of fighting infection. It is classified as any temperature equal to or greater than 100.4 degrees Fahrenheit. In infants younger than 3 months of age, fever can be a cause for concern since babies are unable to tell us where they have an infection, and the cause of their fever can potentially be life-threatening. It is for this reason that infant temperatures must be precise and should be taken rectally. Should your baby have a fever of 100.4 degrees Fahrenheit or greater, then they will most likely need to have a further full examination at the children's emergency room or your local hospital. During this examination and visit, your infant may need blood work obtained, their urine tested, a chest x-ray, and a lumbar puncture, otherwise known as a spinal tap, so that doctors are able to pinpoint the cause of your baby's fever. Though this may sound frightening, and is frightening to most parents, notifying your pediatrician is essential, as there may be potential life-threatening illnesses that your baby may be fighting, and getting immediate treatment is imperative to treating your baby effectively and possibly saving their lives. Parents may notice that their child looks flushed and may have little appetite or thirst during their febrile episodes. They may also be playful 1 minute and then start laying around or appear more sluggish during fever. It is better for you to have a thermometer, though, than to use the back of your hand as one. This is because children may feel hot to the touch after running around, being out in the heat, and just being kids. Before taking your child's temperature, make sure that they have been sitting down at room temperature for at least 10 minutes if they've been recently outside playing and running around. If your child has on many layers, take off those layers before checking their temperature. These steps will ensure that the thermometer reading is accurate. Treatment for fever includes cool compresses, bathing and wetting your child's hair in a slightly warmer than lukewarm temperature in the bath, and taking medicine like Tylenol and Motrin or ibuprofen. If your child is an infant below 6 months of age, use only Tylenol for the treatment of fever. For infants, it is better to use the infant formulation of Motrin and Tylenol instead of the children's formulation. And please follow the directions on the box for dosing, or discuss the dosing with your pediatrician or local pharmacist should you have any further questions. Though fever within the first 3 months of your child's life may be caused by some serious bacteria, the most common cause of fever in children is a viral illness. Viral illnesses last anywhere from 7 to 10 days. This means that your child's fever will likely not go away within 24 hours, even if you're treating their fever effectively. This also means that there are no antibiotics which will be available to treat it. Only supportive care, giving fluids, and keeping your child comfortable. Bottom line, it takes time. That being said, if your child's fever has lasted more than 48 hours, please give our office a call so that we can examine your child more thoroughly to pinpoint the underlying cause. If your child is under 3 months of age and has a fever, please call immediately so that we can get your child to the proper facility for further evaluation. As always, please feel free to call our office, especially if you are one of our patients or would like to become one. We look forward to seeing you. Take care.